Hello guys, so we'll start the quiz at 10:10. 4 more minutes, we'll start the quiz soon. Please join the quiz using the link below. Today's quiz will have questions on cardiac path and cardiac, renal, and GI pathology. So tomorrow we'll be having rest of the topics. Oh, there's a hematoxylin in our quiz today. Okay. One more minute to go. Those who are watching us on YouTube live, please join the quiz using the link provided in the screen on the left-hand side of the screen, or you can just scan the QR code as well. Okay, it's 10:10. We'll start the quiz. So welcome everyone to one more episode on systemic pathology by Juxtamed. So I'm Manoj, I'll be the host for you today for today's quiz. So let's begin. Okay. A 65-year-old man presents with exertional chest pain relieved by rest. Coronary angiography shows a 70% occlusion of the left anterior descending artery. Which of the following is the most likely underlying pathology? So this condition is like a narrow highway where cars, that is blood, can still move, but a traffic jam, that is plague, is forming. Yeah, the right answer is fibrous plaque. Fatty streak is the initial stage where there is not much obstruction caused. So the right answer is fibrous plaque. Okay, we have three of them who has the same points. That is Krishna, Balamurgan, Ashish, Tachi, and RDT. Okay, guys, let's move on to the second part. Okay, a 5-year-old child presents with fever, conjunctivitis, rash, and desquamation of fingers. Echocardiography reveals coronary artery aneurysm. Which of the following is the most likely diagnosis? So here think of a Japanese city and remember this disease can burn the heart if not treated with a intravenous immunoglobulin. Yeah, the right answer is Kawasaki disease. So one of the complications of Kawasaki disease is coronary aneurysm. Okay, let's see the leaderboard. Okay, we have Itachi leading now, followed by Ashish in the second place, Shanmuga Priyan in third place. Okay, moving on to the third one. A 12-year-old boy presents with migratory polyarthritis, erythema marginatum, and a few holosystolic murmur. ASO titer are elevated. Which of the following is most likely cardiac lesion? This is a straight question. I think no clue is needed here. This is often a post-streptococcal revenge that likes to attack the heart valves, especially the mitral valve. Yeah, the right answer is mitral regurgitation. Initially, it causes mitral regurgitation, but when the disease persists and it progresses, we can see mitral stenosis in the later stages of the disease. Okay. Okay, we have Ashish in the first place now, followed by BPAD in the second place, Krishna in the third place, and also we have hematoxylin in the fourth place, Shanmuga Priyan, Urvashi, Aisha, Naga, Momo, RCB, Mahira, Chachi, Vinnar, Mohan, L, Suji. Okay, good going, guys. Let's move on to the fourth one. 28-year-old man presents with chronic diarrhea, abdominal pain, and weight loss. A stool test shows elevated fecal calprotectin. Which of the following is the most likely diagnosis here? So this is like a gut war zone with immune cells attacking the intestine. So this is one of the very important lab investigation. Let's see who gets it. Yeah, the right answer is inflammatory bowel disease. Can you guys tell us how is the lesion seen in Crohn's versus ulcerative colitis? Okay, we have Ashish, followed by hematoxylin, BPAD, Naga, RCB, Myra, Krishna, Shanmuga Priyan, Urvashi, and yes. Okay, guys, let's move on to the fifth question. A middle-aged man presents with right upper quadrant pain, jaundice, and weight loss. Imaging show a mass at head of pancreas. Which of the following tumor marker is most useful for the diagnosis? So, tumor markers, we often get at least one question, which can be asked us directly or indirectly. So, always revising tumor markers is very helpful before the exam. Yeah, test CA 19. Can you guys tell what is which tumor is a tumor related to CA 125, CEA, and AFP? Okay, not much changes. We have Ashish in the first place, PPAD in the second place, and hematoxylin in the third place. Okay, let's move on to the next one. A newborn fails to pass meconium within 48 hours of birth and has bilious vomiting. A rectal exam produces an explosive passage of stool. A biopsy of rectum reveals an absence of ganglionic cell. So, what is the likely diagnosis here? So, if the Ganglionic cells are missing, the gut won't be able to relax. So this is enough, I guess. This is a very clear clue. Yeah, the right answer is Hirschsprung disease. Okay, we have same players. There's not much changes here. Let's move on to the next one. Okay, a 7-year-old child presents with periorbital edema and frothy urine. Urine analysis reveals heavy proteinuria, but no hematuria. A kidney biopsy shows normal glomeruli on light microscopy, but electron microscopy reveals effacement of food process. What is the most likely diagnosis here? Think there is effacement of food process, likely to be a nephrotic syndrome, and also there is a heavy proteinuria, but no hematuria, so likely to be a nephrotic syndrome. Yeah, the answer is minimal change disease. Okay, we have Ashish in the first place. Second place we have PPAT. Place we have Celine, followed by Krishna, Naga, Urvashi, Momo, Aisha, and Pokonda Singham. Okay, with one. A 45-year-old man with long-standing diabetes mellitus presents with proteinuria and hypertension. A renal biopsy shows nodular glomerulosclerosis. Which of the following is the characteristic histopathological finding? So it resembles a big pink ball in a glomerulus named after two scientists. So can you guys also tell us what are the other findings which are seen in diabetic nephropathy? Yeah, the right answer is Kinnelstein-Wilson nodules. So we also see Armani-Epstein lesion and resorption droplets along with this. And GBM is thickened. Okay, we have very close competition between Ashish and BPAD. And third place we have hematoxylin, followed by Myra, Krishna, Urvashi. Okay, guys, moving on to the last second question of the quiz. A 55-year-old male, presents with hematuria and renal mass on imaging. Biopsy reveals clear cytoplasm and cell arranged in nest. What is the most likely diagnosis? So here, this kidney cancer loves smokers and it's often linked to one hyperlipidemia mutation. It is VHL mutation. Yeah, the right answer is renal cell carcinoma. Okay, we have same players, not much changes. So let's see if they change in the final question. Okay, here's the last question. A 55-year-old man with history of hypertension, smoking presents with sudden onset severe chest pain radiating to back. His blood pressure is 180 by 110. CT angiogram shows intimal tear in the proximal aorta. What is the most likely diagnosis? A clear-cut question, and I don't think you need a clue here. So in CT, we uh, see a particular sign which is double barrel sign for this. The right answer is aortic dissection. So let's see who wins the quiz today. Okay, we finally have BPAD winning the quiz today. So congratulations. And we have hematoxylin as a second winner of the quiz, and followed by Krishna. Krishna as the third winner of the quiz. So congratulations, guys. We also have Ashish, Urvashi S, Myra, Aisha, Itachi, Ram, Shanmugapriyan, Porkanda Singham, RDT, R, Naga, Momo. Good going, guys. So, and that's a wrap. And hope you all enjoyed the challenge today. So, let me know how many of you got right, all of them right, other than BPAD. And thank you, guys. Thank you for attending today's quiz. So, finally, we are left with some few systemic topics of pathology, and we'll be completing pathology soon. So, stay tuned for the next quiz.